Hi, this is Dr. A with a lesson on the overview of the U.S. healthcare system, and we're going to look at some basic concepts. So we need to start by saying that the U.S. is the only major country that does not have universal healthcare coverage. Countries all around us and all of the developed countries have universal healthcare coverage. And our system is also one of the most expensive and complex healthcare systems in the world. In 2022, the U.S. spent 17.3% of its gross domestic product on healthcare spending. So that's a way to compare how much you spend on healthcare from one country to the next, because we don't all have the same GDP. So we look at it as a percentage. And so our spending has been up to 17%, around 17% of the GDP for a while. It went up a little bit with COVID and it came back down, but it's still a lot, and it's almost double what the OECD average is. And we'll talk about OECD average in the lesson and what all that is in the lesson coming up. So we have an expensive system, and you think with an expensive system we would have the best of everything, but that is not the case. So we do not have the best life expectancy. We do not have the best infant mortality rate. And so what are we spending our money and what are we getting in our healthcare system is part of what we're going to look at in this course. So both the government and the private sector participate in healthcare in the United States. So it's really a big blend of both. The government has a regulatory aspect, but also payer through programs like Medicaid and Medicare. There are also some governmental entities that are infrastructure, like the Veterans Affairs, hospitals, and TRICARE. So we're gonna have a whole chapter on that. And then the private sector is really what you think about. Most hospitals are privately owned, clinics are privately owned. Private sector would be like all the employees, and then all the healthcare insurance types that you get from your employers. So the major sectors of healthcare are first like the people, the providers. So we have our doctors trained in traditional medicine, and by that we mean allopathic care, but there are also some alternative medicine providers in there. We have the whole medical education system. We have all the nurses in allied health and all the education system for that. So we have the people, right, staffing the healthcare system, and then we have the infrastructure. So the hospitals and the clinics and all of that and how those developed over time. And then we have the whole public health sector, which we'll have a whole chapter to cover and explain what public health is. And then we have the health insurance network, or just health insurance as a major payer in the healthcare system. But the government also participates in that. And we're going to be covering a lot of these aspects in the lessons to come. So there are three main concepts of how healthcare is provided to consumers. The first one is primary prevention. And primary prevention avoids the development of disease. An example of primary prevention includes smoking cessation program, immunization programs, and educational programs for pregnancy and employee safety. So the idea is to keep a disease from developing, to keep a person from getting sick. And public health is concerned a lot with primary prevention. Next is secondary prevention. So this is focused on early disease detection, which then prevents the progression of the disease because we can start intervening and managing the disease, especially if it is a chronic disease. But even if it's not, let's say it's an infection, the earlier you catch it and treat it, the less likely you are to have complications. So examples with chronic disease would include screening programs such as high blood pressure testing. So high blood pressure is a chronic disease. So screening for that is a good way to catch it early before you have problems with renal failure. Colonoscopies to find polyps and things that might indicate colon cancer, or if there is colon cancer, to find it earlier rather than later. Mammograms to detect breast cancer. We could even put there screenings for blood glucose to check for diabetes, cholesterol, screening for heart health. So a lot of the screening testing is going to fall under secondary prevention. And public health is also concerned with secondary prevention, but so is traditional, the traditional medical model, or primary care physicians, etc. Then we have tertiary prevention. And this looks like reducing the impact of an already established disease by minimizing diseases related complications. This is the realm of, medical practice that is one-on-one. So once we have identified somebody that has a chronic disease, then in tertiary prevention, it's trying to manage this disease in the best way possible so that we don't have complications. So like in diabetes, you would want to manage it well so you don't develop renal failure or a stroke or a heart attack or blindness. And so it's all about rehabilitating and monitoring disease individuals, getting them to come in to do checkups, but also doing education so that they can manage their conditions at home with also the help of the clinics. Now, quaternary prevention is an extension of tertiary prevention. It is state-of-the-art medical care with the mindset of mitigating unnecessary efforts on care that may not be working. So once we go into quaternary prevention, we're trying to not overtreat or overdo. So trying to mitigate like last-ditch efforts which may cost a lot of money and not do a lot for the patient. So sometimes it's best to realize where the patient is at and what can be actually beneficial to their quality of life versus trying to throw everything in the kitchen sink at it, increasing healthcare costs and wasting money because there's no effect or no positive effect there. And then the last concept we're going to look at is the iron triangle concept. And it's the idea of, within the healthcare system, of balancing access, cost containment, and quality. And so these all have to be in balance in order to provide good healthcare. So if you look at it, normally you want all three of these points to be balanced. But if there's an imbalance, there are problems. So for example, if the cost goes up, then access will go down, right? Because people can't afford it, or they may be thinking twice about going to the doctor because of the copay, because it's too high, or they're afraid of how much the bill is going to be. And if we decrease the cost, though, then quality could suffer. And so because, then we don't have the money to provide the right services or the services as they should be provided. And so it whenever you move one piece, the other pieces move. And so it is, work to keep all three in balance. And so, okay, so that wraps up our first little primer on the U.S. healthcare system, and we'll continue in the next lesson.